Khaya FM 95.9. Sidebar every Monday to Thursday from 7 to 8 p.m. on Khaya FM 95.9.
Welcome to Sidebar With Sindi with me, Cindy Sale on Khaya FM 95.9. It is a Monday, Afropolitans. On Mondays, we have a doctor's appointment. So tonight, I'll be speaking to general practitioner, Dr. Lestonn. He's a GP with a special interest in aesthetic, anti-aging, and cosmetic medicine. And we're discussing sun damage and skincare.
Sidebar with Dr. Sindi on Khaya FM 95.9.
Welcome to Sidebar With Sindi with me, Cindy Sale on Khaya FM 95.9, home of the Afropolitan. On Mondays, Afropolitans, we have what we call the doctor's appointment, and we try to speak to a GP or a specialist and discuss a certain topic, because we realize that you enjoy health topics and we learn a lot from them. So this tonight is no different. We'll be speaking to general practitioner, Dr. Lestonn. I went to varsity with him, and he has a special interest in aesthetic medicine, anti-aging, and cosmetic medicine. So I'm looking forward to having a conversation with him about sun damage and skincare. Do remember, you can download the Khaya app and listen to the show on the app, or you can go to the DSTV audio bouquet channel 861, or you can log onto our website, khayafm.co.za, and listen live. So Afropolitans, as I said earlier on to Ukuku, I never really thought that as umuntu omnyama, I need to take care of my skin, first of all, or I need to wear sunscreen. So it was something that didn't bother me too much. Growing up, I could be Vaseline, and then as I got older, I started using Dawn. Sometimes you'd use camphor, sometimes you'd use glycerine, and then I started working, and I realized that people take care of their skins. People cleanse, they tone, they moisturize, they use anti-aging, or they use the eye creams and so on. Took a keen interest in skincare, and then learnt a lot about skincare for us, darker people, for black people, and for brown people as well, and realized that the sun is dangerous. So regardless of your skin color, you need to use sunscreen. And I used to have dark pigmentation on my cheeks, and it was just something that I just had, and I grew up with it, and I didn't really mind. Then I bought a cream, quite an expensive face cream, and it had an SPF factor, sun protection factor, of 50. And after about 6 months, I saw that my those dark patches on my skin, on my cheeks, had started fading. And for the longest time, I thought to myself, oh my gosh, this cream really works. So for years, I used that cream. And only later on did I realize that the sun protection factor in that cream had protected my skin from the sun, which was causing that pigmentation. And that was quite a revelation to me. And since then, I've shared this information with many of my friends, especially my older friends, and reminded them that you must use sunscreen, you must moisturize, but make sure that your moisturizer protects you from the sun. And this is the conversation that we're going to be having today, just about the sun and how it affects our skin, and also why it's important for us to go out into the sun, right? Vitamin D is important. We'll be discussing that with Dr. Lestonn. And I'm looking forward to your calls and your comments on 086 0000959. The hashtags on social media are Sidebar With Sindi and Khaya FM Talk. Dr. Lestonn, welcome to Sidebar With Sindi.
Hi, Dr. Sindi. Lovely to have a chat with you.
The last time I saw you, we were at varsity. How many years ago was this? How?
Oh my gosh, I can't believe it. I said to them, I'm sure I know this person.
Of course you do. Listen, we were together at varsity, the Universiteit van Pretoria.
Van Pretoria. I cannot believe it.
Yeah, no, it's been quite a while. I think we were the class of 2005. So we've been doctors for quite a while. But I'm glad that you're on the show, and I'm happy to see that you're doing something as interesting as aesthetics and anti-aging and cosmetic medicine. This is a field that has come up, I think, the last few years. I think we've always thought of skincare, associated with skincare with dermatologists, but more and more general practitioners are doing courses and diplomas and so on, and doing skincare. So it's very interesting that you also went that route.
Yeah, I mean, what you were doing is also really, really interesting. And yes, I just had to laugh at you just making comments about how we grew up. You know, I was also part of the generation in the 80s that grew up with Vaseline and no sunscreen, you know.
And Vaseline, I'm Lestonn. I mean, now that just on the topic of Vaseline, I mean, one of the things that I tell mothers of new babies is that Vaseline is actually not so good for your skin. And they always get shocked. I mean, what do you mean, Dr. Sindi, Vaseline's not good for baby skin? I'm like, Vaseline is not good for baby skin. So I don't encourage mothers to use Vaseline on their baby skin, but petroleum jelly. But what are your thoughts on petroleum jelly on skin, Lestonn?
No, I agree that it does little to nothing for the skin. The skin consists of various layers, and it also has an acid mantle on the outside. And it is really important that we've got what we call a bilipid layer. So there's basically like fat and protein in your skin, and just to put fat is not a good idea, and just to put acid is also not a good idea. And one needs to strike the balance of something that can actually just penetrate your skin, to get to the living layer, which we call the dermis. So to get past your barrier, which we call the epidermis, to get into the dermis and actually make a change there, because we know that it's in the basal layer. It's like kind of in between these two layers where pigmentation also starts. And as I say, Vaseline, I don't really think moisturizes or does much for your skin or to repair or to protect.
And so for the topic for the day is, of course, sun damage and skincare. And, as I said earlier on, I never concerned myself with staying out of the sun, with wearing a hat. I mean, at school, they forced us to wear hats, but as I grew older, it didn't really bother me. And really, the thing for me was, I'm black, so my skin won't be affected.
Absolutely.
And here I am, and I realized that actually I was wrong. So I think let's speak about that myth, and how what work have you done to make sure that we understand that no matter your hue, you need to wear sunscreen.
No, you definitely have to, Cindy. And also, I'm colored. I also grew up with the whole thing of sunscreen is for white people. We are all okay. We kids of Africa, we fine. Our melanin is actually going to protect us. But the sun does cause damage. So both UVA and UVB causes damage to us. And in the past 6 years, we actually realized that we were wrong in thinking that it's only UVA and UVB that damages our skin, but it's actually the full spectrum of light. So light is measured in nanometers, and it's the full wavelength of light that damages the skin. So even just visible light or high-vis light, like all those tube lightings that you find in office blocks or in hospitals, and even just infrared, so all our TV screens, computer screens, cell phones, even just temperature or heat, that also causes damage to your skin. And so there are a few newer sunscreens on the market currently that actually protect against the full spectrum of light. According to law, unfortunately, they're not allowed to put anything, higher than the SPF 50 on. But you'll see them mention things like different wavelengths or high-vis light and infrared that it actually also protects against that, and then thereby prevents pigmentation from forming.
Okay, so basically, so we mustn't. So as long as it's SPF 25 or 50, we are fine.
No.
Okay, we are not fine.
Unfortunately, not. It's better than nothing. It's better than not putting on anything. So yes, putting on SPF 50 is better than nothing. One should also be able to differentiate between chemical SPFs and physical SPFs. So I tend to go more towards the physical blockers personally, but I do think that there are safe chemical SPFs also to use on the market. But we need something that will, as I say, protect us against the full spectrum and not just protect us against UVA or UVB. Because there's still damage being done to our skin.
But the thing is,
so you can be applying a normal SPF 50, but you being sun exposed, not wearing a hat, sitting under lights all the time, working in an office in front of a computer screen all the time with your face close to the computer screen, then going on a December holiday, and obviously not this December holiday, but normally we'd be on the beach or whatever, and then being sun exposed there, which all causes damage and inflammation in your skin. And it is actually the inflammation that causes, or that is the driving force behind the pigmentation. Inflammation is the driving force behind aging and pigmentation. And so although acute inflammation is the way the body heals, but chronic inflammation is bad. And so burning yourself every day, you're causing wound upon wound upon wound, which then leads to either pigmentation or keloids or even skin cancer.
So, okay, and skincare is sunscreen. Skincare is expensive, but sunscreen is frightfully expensive. Dr. Lestonn, why is it so expensive? Because that's another barrier to the use of sunscreen. The price.
So I agree with you. I hear you about the cost perspective of sunscreen, and often also of medical skincare is a lot more expensive even than a lot more. I'd often say that there are definitely higher end, your Estee Lauders and your La Mers that you buy over the counter. Mm-hmm. That's just expensive as medical skincare, or more expensive than medical skincare. But the difference is that, studies for us to find out that it's not just UVA and UVB and which wavelengths actually cause damage, to actually have those studies done costs money. And then there are certain of the medical skincare ranges that have patents on certain things for a few years, like with original medication versus generic medication. Yeah. It's the same thing with skincare. Having medical skincare versus what I then call generic skincare, which is something that you can purchase over the counter. Also, I always advocate that somebody rather first just consult with a medical professional before just willy-nilly purchasing anything online or trying all these home remedies that one can, Dr. Google and its home remedies. I never advocate that to patients.
Okay. And so, in terms of how much sun we should be getting on average per day, I'm living with depression, and one of the things that I was advised to do was to check my vitamin D levels and make sure that they're normal, but also to try and get as much sun as I can. And I must tell you, it makes a huge difference. Just to go out, that's our winter. Winter is particularly hard for me because there's not too much sun. But summer is really fantastic because I get out into the sun, I sit in the sun for about 20 minutes, and I feel good. So how much sun should we be getting, and what is too much sun?
So firstly, I think that between 5 and 15 minutes of sun exposure is more than enough. But secondly, Cindy, with the advent of COVID, we know that, and this is something that we've been talking about for a while already, but with COVID it's just been proven that across the globe, more than 80% of patients are vitamin D3 deficient. And for two reasons, South Africans for the longest time thought that we were fine because, one, we've got the African sun, and two, flora or whatever was telling us that there's vitamin D, so we're fine. And you need quite a bit of vitamin D3 to actually have sufficient levels. So even if you were getting 5 to 15 minutes, which, as I say, I don't think that you need more sun exposure than that, I still think that taking a vitamin D3 supplement is of utmost importance. And not taking necessarily a vitamin D2 supplement, I won't mention names now, but I think that it's important to take the D3 one and not the D2 one.
Okay, so we're learning a lot. That's very important information. If you've just tuned in Afropolitans, it is a doctor's appointment. Every Monday we speak to a doctor and we learn something new or learn something important, and tonight is no different. We are speaking to Dr. Lestonn. He's a general practitioner with a special interest in aesthetic, anti-aging and cosmetic medicine. And we're discussing sun damage and skincare. And I was saying earlier on that the myth is that if you're darker skinned, you don't need to look after your skin that much, and you certainly don't need to use sunscreen. And Dr. Lestonn is educating us about how that is wrong. We all have to make sure we take care of our skins. And if you've missed the show, not to worry, you can catch the podcast on FM Rewind if you go to our website, and the podcast should be uploaded in the next day or two. Dr. Lestonn, so different parts of the body and absorbing the sun. You also want to avoid getting sunburnt, because that is a reality. I've been sunburnt before, and it's quite painful. Not as painful as it is in people who are lighter skinned, but it is painful. So if I want to, get some sunshine, especially to boost my vitamin D levels, is it arms, legs, body, bum, back? What's the best way, or it doesn't really matter?
What I tell my patients is just don't. I say living in Africa, you get enough sun exposure, because driving to work, you get sun exposure. You've got windows, you've got reflective surfaces in your house, and you're getting sun exposure. So just avoid the sun and rather drink vitamin D3. The other thing that I just want to tie into what you were telling your listeners now about the myths about darker skin types not needing sunscreen is the fact that we are actually more prone to form pigmentation than the lighter skin type. So African colored and Indian skin is actually more prone to form blemishes than what the fairer skin types are. And there are various factors that cause that. It's not just got to do with the sun, but it definitely also plays a role. The other thing that I tell patients also is that, we often think that it's the sunburn that you got now.
Yeah.
So you think that, okay, I went home, I had a December holiday, I wasn't working, I was in the sun every day, and I got sunburned, and now I've got sun damage. But the sun damage that you have now is not because of the holiday that you just had in December. When you start seeing blemishes, that's sun damage that occurred decades ago. That sun damage occurred in your teens when you were playing netball at school without wearing sunscreen, or as I said, just being outdoorsy as a teenager, or when we were at varsity and not applying sunscreen. And you're only seeing that damage come to the surface now. So we often talk about drawing out pigmentation, and by doing treatments or applying certain creams to the skin also, I often warn patients that the pigmentation can first go darker before it goes lighter, because it needs to be drawn to the surface and then it needs to fall off.
I'm learning a lot.
You're seeing decades later damage now only. And then patients are also often impatient. So something that I also heard you say is that you're using sunscreen for 6 months. Patients walk into my office and they want to look better next week. And unfortunately, it is a lengthy process. It's not a quick fix.
086 0000959 is the number to call. Do take advantage of the doctor's appointment. Dr. Lestonn is on the line to answer all your questions. He is a GP with a special interest in aesthetic, anti-aging, and cosmetic medicine. Dr. Lawn, what about age? How does age affect our skin? I mean, I'm 44. I'm turning 45 in April, and I think funny enough, my skin is improving as I grow older. And it's been interesting to watch. When I was younger, I had very bad skin. I had acne and so on. And then I went through the phase of the patches and so on. And now my skin is getting much better as I grow older. But that's not always the case for everybody. So how does age affect our skins, and how does age affect our skin's response to the sun?
There are two things that I'd like to answer in what you've just said. The first thing is the fact that you're saying that you've had worse skin and that you now have better skin, and then you mentioned the word acne. But with acne, again, remember I said inflammation causes aging and pigmentation. So we actually don't speak of aging anymore. We speak of inflammaging. And that's why I said that there are various factors that actually affect this. So there's a very strong gut-skin relationship. We've got millions of different types of bacteria and fungi in our gut, and we've got the same stuff on our skin. And when there's an imbalance in that, and the whole thing of leaky gut syndrome, and then it depends on your genetic predisposition, what happens to your skin when you have leaky gut syndrome. But the second thing is just in terms of acne, the red pimple left you with a black mark because the inflammation became
and little holes in my skin, little
and
yes, because I used to squeeze them, so I've got little holes, lots of little holes in my skin.
So you can imagine if that inflammation causes little holes, that with aging, the inflammation actually causes the wrinkles, and that's why we speak of inflammaging. And yes, there's also glycation and insulin, and as I said, there's a lot more that one can go into. But the big thing is to curb inflammation to get a nice skin. The second thing with aging is that our skin turnaround time slows down. So up until about the age of, I'd say, between 25 and 30, our skin turnaround time, so you're shedding skin all the time. All of us are shedding hair and skin every day of our lives. It's not visible, but we are shedding. So that normally takes about 28 to 30 days to move from the basal layer to the top layer and fall off. As we become older, this takes longer and longer and longer and longer. And so let's say we get to a place where it now takes 40 days or 50 days. That's where you see all this melanin being trapped, and you start seeing blemishes on your skin, and you start seeing liver spots on your skin, and you start seeing thickening of the skin, where you can either you keloid or, as I say, form wrinkles.
I see.
And sun damage is not also just with pigmentation, because it causes loss of elastin fibers in your skin too, which then leads to loose, crepey, wrinkly skin.
Okay.
Again, also different ethnic groups respond differently. So, there's also the other myth that black, so it's entirely a myth, but black don't crack. But I always tell my patients that black don't crack, but it sags. Because you have elastin loss. So,
I am learning, and I'm taking notes. Because I really love my skin at the moment, and I want to look like this for the next 15 years. But we're taking a break now, Afropolitans, and we'll be back after this break with Dr. Lestonn to continue our conversation on sun damage and skincare.
Because a conversation a day is exactly what the doctor ordered. Sidebar with Sindi. Every Monday to Thursday from 7 to 8 p.m. on Khaya FM 95.9.
Welcome back to Sidebar with Sindi with me, Sindi Siwe on Khaya FM 95.9. It is a doctor's appointment. Every Monday we speak to a doctor. And tonight we're speaking to Dr. Lestonn. He's a general practitioner, and he has a special interest in aesthetic medicine, anti-aging, and cosmetic medicine. And we invited him onto the show so we could speak about sun damage and skincare. And if you've missed the show, Afropolitans, you can catch the podcast on FM Rewind. It's an important one to listen to because, we've addressed the issue of darker skin, black skin, and the importance of looking after our skin and the importance of using sunscreen. Because I grew up thinking that I didn't need to do all of that, but actually I was wrong. It is important for us to look after our skins and to use sunscreen. So, Dr. Lestonn, why do babies need extra protection from the sun?
I don't know why it is that I'm hearing you softer now, but please could you just repeat that?
Why do babies need extra protection from the sun?
So you must also just remember that you are still forming the different layers of the skin. And as I said, as we become older, these become thicker and thicker and thicker. So it is a lot easier for that sensitive, tender skin to firstly get inflammation, get damage, by the sun. And it's also important to know that that babies can't necessarily use the same sunscreen that adults use, specifically when it comes to chemical sunscreens, because that can actually be toxic to them. That can actually cause organ damage to them. So it's important to use a pediatric formulation if you're using, a chemical sunscreen versus a physical sunscreen.
So considering the price, Dr. Lestonn, of skincare products. So my starter, as I said, when I started working and I could afford things a bit, I started off with a specific brand because that's a brand that everyone spoke about and it was advertised everywhere. So you had to get you had to get the cleanser. It was either a bar or gel. You had to get the toner, and then you get the moisturizer, right? And the toner used to really burn my skin. It was hectic. But because in my mind, this is the three steps that you must do to get a beautiful skin. The three steps. I kept on using that toner until, I put it onto my skin and my face would sting. And in my mind, that sting was the working. That the more it stings, the more it's working.
Yes,
it means it's really getting in.
That's how we were raised.
Right? and then eventually I thought to myself, I actually can't do this. This thing is not working for me. So I stopped the toner and everything changed. And I stopped that tingling. I realized then that the tingling was actually not a good thing. So many of us get sucked into the marketing around these products, and you want to buy everything from the same range, and you want to make sure you have the whole thing, and it's very expensive. But I've learned now that I don't have to do that. I can use a cleanser from someone else, and then I can use a toner if I want to from someone else, and moisturizer from someone else. So just talk to us a bit about that, and then maybe it just highlights how we do get sucked into the advertising of skincare products, because that is the truth, right? I know they mean well and they want us to have good skin, but there's also a lot of marketing around it. So let's just speak a bit about that.
Yeah, I must be honest, I don't know if they always necessarily mean well. I do think that there are people out there who do mean well, and there are people out there who just are wanting to make a fast buck. So firstly, I don't think that you always need a toner. I personally don't use a toner.
Okay. So who would need a toner?
it depends on the cleanser that you're using.
I see.
So if you're using a soap bar, your pH is probably highly likely to be above 7, which is a problem. Because as I was saying just now, that the skin has a natural acid mantle. So you want to get your pH lower. Water's pH is also more alkaline. So you want to use something. So if your cleanser already has some form of acid in, let's say, glycolic acid or salicylic acid, then you're already taking down the pH of the skin. And if you're then putting on your serums or moisturizer or whatever it is that you're putting on afterwards, and your sunscreen goes on last, you're fine. You then don't need to. I personally use a glycolic acid cleanser, but as I say, there are other things like azelaic acid or salicylic acid that also works well. And so you can already save by not buying the toner, and then rather spend a little bit more on an antioxidant serum, or for seeing that you're speaking pigmentation specifically tonight. The one thing that I feel that I have to mention to listeners is a tyrosinase inhibitor.
Okay.
Now, I understand it's a complicated word. Tyrosinase is just a fancy word for the enzyme the skin uses to make pigment. And if I reduce that, I reduce the skin's ability to make new marks. And having a good skincare routine is like brushing your teeth. If you want good teeth for the rest of your life, and you don't want to get false teeth as an older person, brush your teeth twice a day, see the dentist as well. And I tell patients it works the same with skin. Use good skincare every day of your life. Come in for a treatment every now and again. Depending on the results that you want. So if we're correcting something, I tell patients you need to come in monthly for a treatment. If we're just maintaining something every 3 months, 90 days is what it takes the body to make new collagen. But back to a tyrosinase inhibitor. That usually comes in the form of a serum. And there are many different tyrosinase inhibitors. There are many different ingredients that can inhibit tyrosinase and that can prevent new blemishes from forming on your skin. At the Renewal Institute, at Skin Renewal, when we treat skin, no matter whether we're treating white skin, but in particular with darker skin types, with African skin or colored skin or Indian skin, you have to be on a tyrosinase inhibitor before we are willing to do treatments for you. Because I also say to them that, so, I mean, firstly, when we were studying medicine, aesthetics didn't exist.
It didn't. Lestonn, people don't understand this. It was only the dermatologists that did everything.
Yes, and I mean, the little exposure that we got to derm was if it's wet, keep it dry. If it's dry, keep it wet. And as you say, the more it burns, the quicker the result. You know, the better for your skin, which is, all of that is just a lie. But yeah, so tyrosinase inhibitor is really important for darker skin types. And I've seen it so many times already where patients come from dermatologists or from clinics specializing in lasers. So 30 years back, we thought that we can't do chemical peels or laser treatments on non-white skin.
Yes, that's true. That is what we were taught, yeah.
But today we know it is not true if you prepare your skin with a tyrosinase inhibitor. Okay. Now, fair enough, there are still certain types of chemical peels and certain types of aggressive lasers that we can't do on darker skin types because we run the risk of causing post-inflammatory hyperpigmentation, PIH for short, or, you know, darkening your skin basically, and burning you. But if you're using a tyrosinase inhibitor, there are various amounts, plenty chemical peels that we can do and plenty lasers that we can use on your skin to improve pore size, acne scarring, pigmentation, whatever your concern might be.
Okay, so listen, we have a caller, but when we come back from the caller, I'm going to speak about, I have polycystic ovarian syndrome. And I grow hair. I grow hair on my chin, and I grow a moustache, which I wax or I tweeze, and it's very painful.
And you need to watch for melasma.
Yes, so we'll speak about it when we come back from the caller. But we have Sihle calling us from Johannesburg. Sihle, welcome to Sidebar With Sindi. And what question do you have for Dr. Lestonn Lawn?
Thanks for giving me the opportunity, and good day to you, Doc, and you, ma'am. The question which I have is, I have a uneven skin tone, or besides my nose and my forehead. And I've kept on like thinking that maybe it's because I don't scrub my face properly, or the soaps which I use doesn't work. But I kept on scrubbing, but it's increasing because it started back in 2012 up until today. My teeth section is actually getting darker and darker. I don't know which products to use because I've tried some products and never worked.
Okay, Dr. Lawn?
So, Sihle, the first thing is that where you're saying your pigmentation is on your nose and on your forehead, that if there was an injury, then we know that caused that, but that's also typical places for melasma to happen. And melasma can actually, which is hormonal pigmentation, can actually happen in male patients too. So that's the first thing that we need to differentiate, what type of pigmentation is it that we're talking about. And then secondly, the scrubbing thing that you're talking about is exactly what I was speaking to Sindi about earlier, that we were taught that, the more it burns or the harder I scrub, the quicker I'll get rid of this. But actually, you're just adding insult to injury. You're just burning yourself more. And that's why your pigmentation is worsening, because you're causing more inflammation by trying to scrub it off. It's better to use gentle exfoliation, take a longer time, go slow with it. And as I say, if it is hormonal, then one would need to look at some supplemental support to support your liver with phase 2 detoxification of xenoestrogens that we get into our drinking water, our meat, anything that comes in plastic, polystyrene. So, there's not a one-size-fits-all. It's not an easy answer that I can give you. But what I can tell you is don't use stuff that burn, and definitely don't scrub, because it's just going to make it worse.
Sihle, I hope that helps you.
Doc.
Okay, thank you so much for sharing that with us.
Moisturize, heal, and put sunscreen.
Thank you so much for that, Lestonn. Thank you, Sihle, for calling. Lestonn, so as I was saying before we took Sihle's call, I have polycystic ovarian syndrome. So I'm hairy and I have a beard. So every 2 days I need to tweeze or shave it or whatever it is. And I'm tired of that because the hairs come back thicker, they come back stronger. And so when I tweeze them, they leave marks on my chin, right? And I've got lots of little black marks on my chin. So why do they leave those marks? Because when I tweeze my eyebrows, I don't get that. But on my chin, I get that.
So you're causing, again, it's the injury. It's literally the inflammation that causes pigmentation. And it can happen at various places on the face. And it's strange for me that waxing isn't also causing that for you, because waxing still has heat added to that, which should then, which can also aggravate pigmentation. With the hair, there might be an ingrown hair that forms.
Yes, there are a lot of those.
Using it, and that causes, that ingrown hair, actually that bacterial inflammatory process that then happens in that hair follicle, leaves you with a mark. Where I can promise you, if you were on a tyrosinase inhibitor, even if you were still tweezing, you wouldn't be ending up with new mark. But again, also I do think that I'm assuming that insulin and glucose, there's somebody checking you out for that, and or you yourself are, because the whole thing of glycation, aging, insulin resistance, it's just so much more prevalent than what I ever thought it was.
It is. And and the way I found it is because I was struggling to conceive. So, and I am overweight. So the two go, they go together. So it was quite an eye opener for me. But I think I will consider coming to consult with you and getting the tyrosinase inhibitor and to see if it helps, because those marks really do annoy me and the beard really does annoy me. And I'm not the only one with this problem. I know lots of women with beards and they let them grow. I can't, because I'd probably sit there pulling it the whole time. So I want it off my chin and I want the mustache off my face, but it is challenging. And speaking of anti-aging products, there's quite a lot of them on the market. I think there's more and more of them coming onto the market as I get older and more interested in anti-aging products. If an Afropolitan is thinking of starting anti-aging care, skincare, what are the basics that we should have, in our bathrooms or in our cupboards?
Yeah, so the first thing is that I always tell patients that sunscreen is the most important thing. If you can only afford one skincare product, that's what you buy. because sun is worst enemy of skin. Secondly, I'd say that make sure that your cleanser already has some form of acid in, but not something that burns you. Not something that causes irritation on your skin, because that can worsen problems. But that it at least lowers the pH so that you can get penetration, because you can use the most expensive stuff if it's not penetrating into your dermis, where collagen and elastin and hyaluronic acid and all those good things are happening. It's pointless. So get a cleanser that, as I say, will bring down the pH of your skin without burning you. Then you don't need a toner. You can skip on that thing. And then it really varies. So the most important thing, I'd say, is maybe get a moisturizer that contains peptides. So if you look at the collagen molecule, if you break that down, you get 4 peptide chains. If you break the peptide down, you get growth factors. So when you're reading on the back, what is in the product, it should be written something peptide, copper peptide or trihydropeptide or something peptide, which means that, or they should mention that there's growth factors in there. The other false thing, though, Cindy, is I always tell patients that, let's say we've got a container as big as a room.
Yes.
And I put Vaseline in there and I throw a drop of vitamin C in there. Then I can say that there's vitamin C in my product. Or I can say that there's peptides in my product. So how much can it actually penetrate? And these things, so the patents get passed on, and that's why there's more and more and more coming out now. But the medical skincare ranges are already advanced. They've already made new discoveries of better penetration, so you need to get skin turnaround time, and I tell patients exfoliate at least once a week. Don't use, and this is a personal opinion, but don't use a mechanical exfoliator. So anything with beads or pips or seeds or whatever, rather find yourself a chemical exfoliator than a mechanical exfoliator, because how hard must you rub, how long must you rub, you're actually causing injury to skin. Where with a chemical exfoliator, it's a serum you put on, and I tell patients, you wash your face, you put on the exfoliator, you wash your body, you rinse your face, and you're done. So it's important to exfoliate once a week, get a good moisturizer, get a good sunscreen. There are moisturizers that you can use morning and evening, something that either contains peptides or growth factors to stimulate collagen. That's the basics. There's a lot more that I can tell you about.
I think the basics. I mean, it's a good start, and already you've given us the vocabulary to use and to look for peptides and collagen. Exfoliate once a week. When you come back from the break, Dr. Lawn, I wanted to speak about the stinging of products and how we feel that it means that the product is working, and also the fragrancing, because I must tell you that there's certain brands that I like more than other brands only because they smell so nice, right? And the plainer the smell is, I'm less likely to buy that product. So we need to talk about that, because that fragrance also then contributes to some of our skin issues.
Absolutely.
I want my moisturizer to smell in a certain way. So we'll talk about that when we come back.
So male versus female as well, Cindy. And please stop calling me Dr. Lawn. Please call me Lestonn, else I'm going to have to start calling you Dr. Van Sail the whole time.
So when you come back, we'll speak about that male, the blue. The shower gel for the males is blue and it smells a certain way, and ours is pink and it smells a certain way, and how we should really not be using those products all the time, especially if our skins are sensitive. But Afropolitans, do stay tuned. I'll be back after this.
Sidebar every Monday to Thursday from 7 to 8 p.m. on Khaya FM 95.9.
Welcome to Sidebar with Sindi. It is the last part of Sidebar with Sindi for this evening. It is a doctor's appointment, and Dr. Lestonn Lawn is the doctor for tonight. He's a general practitioner with a special interest in aesthetics, anti-aging, and cosmetic medicine. So before the break, I'd asked Dr. Lestonn to explain to us why we are so mesmerized by products smelling nice. And look, okay, let me speak for myself, Afropolitans. I like things that smell nice. So if I'm going to buy a skin product, I want to smell it, and if it smells nice, I'm going to buy it. But unfortunately, fragranced products aren't always so good for us. So Lestonn, let's go into that a bit.
Yeah, so Cindy, fragrance products aren't necessarily always well in the first place, and then the product has a feel to it too, and I'd often, you know how many times reps come and visit us and tell us to feel things and to, where I'm all about the science. If you've got studies, if you've got published studies, I understand why your product costs more, because you've actually spent money to get that. I don't think that anything is necessarily really, you can't really have horrible smelling stuff, but and I also know for females it's
castor oil smells horrible.
Lestonn,
castor oil smells horrible.
yes, no, but so I think the less additives, the better. The more active ingredients that you can pump in there, the better for your skin. And I must say, I sometimes battle also because people would say, it feels sticky, or they'd want something that feels more mattifying, and obviously also determine like your own skin sebum production also has an effect. Some of us tend to have more oily skin, which makes us more prone to acne, but which saves us in the long run from wrinkles. And some of us have, we're not producing any sebum, so they're dry, sensitive, red. And that's accepting for the different hues of skin, or the Fitzpatrick scale that one has of skin. But back to the perfumes, for me, really, it's not important. But I understand that it is for people. I think that it's a trick. I don't think that there's something that that there's a good ingredient that really smells nice, and I think that it's important for product houses to find a balance between something that still feels nice and smells nice, but actually has the medical ingredients or the active ingredients in to make a difference.
And I think striking that balance will always be the challenge. That bliss point where you're happy with the texture of the product, the way it smells, and the way it feels, because it does really make a difference. We have a caller. We have Brian calling us from Johannesburg. Brian, welcome to Sidebar with Sindi. And what question do you have for Dr. Lestonn?
Hi, doctor. Thanks for having me. So I'm a male and I shave. And what I start to see is that I have these black marks and sometimes ingrowth hair. And then just another question. Is spirit good for our skin after shaving? Thank you.
So, Brian, the last part, what is what good for our skins after shaving?
Spirits.
Brian, hey. I have a bald head, right? So I call myself Baldilocks. And I'm always bald. This one time, Brian, I go to this hair salon I hadn't been to because I wanted a certain cut, and they shave my hair. I get the cut, I get the line, and the guy didn't actually ask me if he can dab spirits onto my head after, So I'm sitting there on my phone as always, and the next thing, my scalp is burning. Here's this person dabbing spirits onto my scalp, like freshly shaved scalp. I'm like, what are you doing? And he goes, no, it's going to make sure that those bumps don't come up. That guy does the best fades, right? I never went back to that hair salon. So, Dr. Lon, spirits after shaving or after cutting our hair?
So I'll start with the spirits and then I'll go to the ingrown hairs. With the spirits, we're back at our parents taught us this, right? It needs to burn. Mercurochrome, when we were kids, that red stuff, it used to burn like fire. The more it burns, the quicker the wound will heal, which is totally not true. Again, you're causing insult to injury, you're causing inflammation, and that will leave you with marks. You want something that would rather soothe. When you're shaving, for me, it's very interesting that we had two male callers. I thought that there would be more female callers. But when shaving, I always tell my male patients that, the branding, again, it's an advertising gimmick. MAC highest number or whatever shaver highest number of blades is better. And that's actually a lie. Single blade is the best. You want to leave a little, so you just want the hair equal with the skin. You don't want to take off skin and then make that, because the skin grows quicker than the hair, which causes the ingrown hair. So the higher number that you're using, you're taking off skin and hair. If you're using a single blade, you need to shave more regularly. You might need to shave every day or every second day. So yes, it's a bit more effort. But you're not going to be getting that ingrown hairs. And an ingrown hair works exactly like a pimple. The inflammation leaves you with pigmentation. So instead of putting spirits, putting a tyrosinase inhibitor, if it's in the evening, something that maybe contains vitamin A, retinol, which helps with both pigmentation and skin turnaround time. But one needs to be careful also with retinol in terms of strength, percentage. I'm not a fan of retin A, I'll say that out loud. I think that there are a lot better things on the market currently than the medical grade retin A. But yes, using something like retinol or using whichever, I don't want to promote a specific product house now, but using whichever product house serum that is a tyrosinase inhibitor, I'd rather put that on. And I'd also use my cleanser as a shaving cream. So I wouldn't purchase an extra shaving cream. I'd use my cleanser as the foaming agent and use a single blade. And I found that sorts out all the problems.
Okay, so that's lots of learning. I'm taking notes, and I hope that people are going to listen to the podcast because you are sharing so much important information with us, Lennon.
And it saves you so much, Cindy, really, like literally when I changed to, those normal orange and white, whatever, if it's Discam or Bic or whatever, single blade, costs you so much cheaper than all these fancy stuff that that you're using. And so, as I say, sure, it takes a little bit more effort because I need to shave. For me, I take long to grow a beard, so I shave every second day. But it might mean that you need to shave every day, but you're still not going to end up running into problems. And definitely not spirits or lemon juice or vinegar or none of that.
Yeah, because I think it's that astringent feeling that we want, and we think it's helping and it's working, and it's actually irritating your skin. So let's speak a bit about sunburn. So you say you have found yourself sunburned. What's the best way to treat sunburn?
Yes, I definitely have found myself sunburned quite often. I do think, again, that soothing agents, and if you want to go totally natural, something with aloe vera in, well, you want to heal because you must think of it as an injury or a wound. And then there are certain things that would restore your bilipid layer. If you're looking for I don't think that people will remember this word, but the fancy word for it to look for in creams is called ceramides. Ceramides actually help to restore your bilipid layer and the function of your barrier of your skin, because your barrier has now been injured. And you want to put back as much moisture as you can. And for the first, I'd say about the first week thereafter, you're not looking at exfoliating, you're not looking at using anything, your normal skincare, which has active ingredients in, because it will sting more on the skin because there's inflammation in the skin now. So you want to soothe that inflammation, you want to soothe and calm the skin. And that's something, if you're looking for something natural, probably something like an aloe vera. But if you're looking for something medical, the word to look for in the skincare routine is called ceramides. And then to do sun avoidance and not cause further injury, and obviously sunscreen.
Sunscreen. I will not forget that. And we also have to wear sunscreen in winter, right? It doesn't matter summer, winter, autumn,
come
spring.
Come rain, come shine, whether you just tell me that you're indoors. I tell patients, you live in Africa, you can't avoid the sun. When you're driving to work, the sun is there. If you in your office, is there a window? Accepting that the sun causes damage first. Are there lights in your office? Are you sitting in front of a computer? Sitting close to a heater, in winter. That heat is infrared B that causes pigmentation. So always sunscreen, come rain, come shine, every day of your life. If there's one thing you have in your cupboard, there was this song when we were at varsity and that gave us all advice. And the one thing that the guy said was always wear sunscreen.
I remember that. So, in closing, we have about 2 minutes of the show left, Lestonn, and I want to ask a question about Botox, because you do aesthetics. And then I also want to ask about, skin lifts and so on. So, what are your thoughts around aesthetics and Botox and so on? And are you seeing more and more people of, black people and kind of people, Indian people coming in for such procedures? Just your general thoughts around that.
Yeah, I'm definitely seeing a lot more black people, Indian people, colored people coming for aesthetics. We can be honest about it that traditionally it was a bigger taboo for us. When I went into aesthetics full time, it was a massive family affair. There was hectic resistance from the rest of my family. But I definitely am seeing a big increase in the number of black patients and Indian patients, colored patients coming through. I think it's important for me. I really like a natural look, and so I think black don't crack. So black patients would need less Botox, and could even get away with baby Botox, but it sags. So we need to look at fillers in terms of that, which is hyaluronic acid, which we're born with in our skin. And becomes less and less and less. And that's how patients isn't human hyaluronic acid. It's made in a lab, but the body recognizes the molecule. And not only is it responsible for moisture in your skin and helps with hydrobalance and hydration of your skin and texture, making it smoother, making your skin smoother. You can also even do lifting with fillers these days. And as we age, our skull changes. We have bone resorption as we age. We have fat pad loss as we age. And by laying filler down onto bone, you slow bone resorption down, and you restore those fat pads to original youthful look. I must say that towards the end of last year, and even just being back at work now, I'm seeing a lot more people wanting to look weird, wanting the cat eye or fox eye look.
Really?
Or wanting the maleficent cheekbones. And I suppose one needs to cater for everybody, But
there's a show.
It's not something that I go for, because I always tell my patients that you might advert out there.
Yeah.
And so if I'm going to give you a trout pouch or duck lips, I'm going to give you maleficent cheekbones, and you go and tell patients that, I've been your doctor or I've been injecting you, nobody's going to want to come and see me.
Yeah.
So I think that less is more. And I think that the natural look is important,
and we must stick to that.
I definitely am seeing an increase in people of color coming through.
Okay, well, we've run out of time, Lestonn, but I think we'll have a follow-on conversation to this, because I think we should have a whole show on aesthetics and just how to go about it and how to make sure that the person that you're using is reputable. But thank you so much for sharing all the information with us, and all the best with all your work.
Thank you, and to you, it was really, really lekker caring with you. I hope we'll chat soon again.
Thank you so much. Afropolitan's 8 p.m. Khaya on the agenda coming up now.